For reasons I will probably never understand, I found myself in the highlands of Guatemala, surrounded by doctors and nurses from Canada. We were setting up short-term clinics, moving from town to town, and that's how this got started 10 years ago. My name is Hellman. I started my career as a programmer and ended up as an executive with some large international technology companies. Within weeks of that first trip to Guatemala, I found myself on a plane heading straight back. I wanted to see if the permanent clinics in the rural settings had the same set of problems I saw with the short-term clinics. Indeed, they did. I've since learned that these problems are common, that in these locales, patients have very common names. They typically don't have addresses, they typically don't know their date of birth, and there's nothing akin to a social security number. So identifying patients by their name is next to impossible. So the question is, how do you keep accurate medical records and have them readily accessible for medical staff? How do you create a system so that a visiting team from California can create medical records, and yet those records and the patient's histories that have been captured are available to a visiting team from Texas when they're not even communicating with each other? So in Guatemala, I've actually run into sisters, mind you. They both were named Maria Teresas. I don't remember if their last name was Gonzalez or Hernandez, but they had the same names. So in a world like this, how do you look at a patient's record and know which Maria Teresa Gonzalez the paper record belongs to? And the answer is you can't. We solve this because when a patient registers at the clinic, we capture their fingerprint. So when they come back, we also do their fingerprint, and we know exactly which records and how many visits they've been here in the past and which records are theirs. There's no doubt, there's no ambiguity, and it all happens instantaneously. Rarely does a patient have an address, but we don't find that as a problem. When a patient registers, we know what town they live in, and as soon as we know that, a map pops up. And the patient points out where on the map they live, and we record that. So we're capturing the GPS data behind that and merging it with our medical record. Once I figured out how to make these problems work, or how to solve these problems, I realized that the data I was collecting and the method I was collecting them in was much bigger than what I had realized. Because healthcare is more than just a doctor meeting a patient. It's more than a doctor and a nurse and a pharmacy and a laboratory meeting with a patient. There are whole teams of people in the background, a whole plethora of people working to make health a reality for the people in these regions. So what I had done was the data I had gathered enabled all of these groups to work more efficiently, work in a collaborative fashion and cohesively, if I put it together right. In most cases, we're receiving the data from the clinics in real time, which enables us to create maps of disease patterns in real time. Think about that. Right now, most places are reporting the diseases they encounter to the Ministry of Health 30 days after the fact. We are in the area of 30 seconds after the fact. When you're looking at a collection of medical data, you can see things that aren't obvious when you're looking at a patient one at a time. For example, it was a cold, snowy night in January. I was in my home in Virginia, and I was looking at the data from a clinic in Haiti. And I remember thinking about the contrast probably we had in the weather. But I noticed when I was looking at all of the patient vital signs, there were just simply too many patients whose body temperatures were too low. It did not make sense, unless the equipment was bad. I spotted that. In Haiti, they hadn't noticed. I did contact the medical director at the clinic the next day and confirm my suspicions. They had purchased battery-operated thermometers all at the same time, and what we discovered was 2 out of the 3, the batteries were dying. But I saw that in my home in Virginia through the software, whereas the clinic did not see that. And oftentimes you will see groupings of certain classes of diseases. For example, you may see a cluster of diseases that are digestive related. When you see that, that typically suggests that in that area the drinking water is bad. You can see that from the collection of data when you cannot possibly see that by looking at patients one at a time. The software enables you to do that. So where do we stand now? We have a easy-to-use electronic medical record system, highly reliable, that runs at the clinic. And so internet connections is not an issue. But when the internet's available, data is replicated to a centralized server. We identify patients accurately, correctly by using their fingerprint. And the system works in 50 different languages. So data can actually be entered in English and then read later by a Spanish speaker, in Spanish obviously, or data can be entered by the receptionist in Haitian Creole, entered by the nurse in French and the doctor in English, and the pharmacist in German, and they all see each other's work in their own language. It's an extremely powerful system, but highly, highly easy to use. We continue to build out this system. We want to make it more efficient and easier for all the other participants in the health care delivery world to do their role and fulfill it well, so that every part of it is connected to the other part and every part of it is as easy as possible for each other. We want to make people healthy. We want to make the world a better place. Soon we'll be working on a tablet-based home health care system so that we can enable doctors to coordinate the care of patients at home and view their status without having to actually travel to their houses. We also intend to develop modules for a special emergency room module. We're going to do modules for prenatal, neonatal, neurology, ophthalmology, and dental. My name is Hellman. I'm with Four Corners Medical Software, where we've done a lot. We're going to do more, and I'd like for you to join us.